we also know that in Virginia, over at Terminal A at Dulles Airport, there was an incident in early March where yet again, someone now confirmed to have measles actually happened to be within that airport. Joining us to discuss the precautions that perhaps can be taken and so much more is Dr. Eugene Lipov back here on the Live Zone. Dr. Lipov, always good to see you, sir. Welcome back to the show.
Great to see you, sir. Thank you.
What makes measles so infectious? And I know that's such a broad question, but there are so many that are still trying to wrap their head around as to why this is still an issue in 2026.
Well, a number of issues come to mind. One of them is it's a very infectious virus. It's one of the most infectious viruses that are known to mankind. Part of the reason it's produced in the nose when you get an infection, it replicates in the nose and the lungs. And when you cough, it can go a long distance because a very small droplets can maintain that virus. Most of the viruses which are out there just cannot survive in a very small amount of moisture. And so a very small virus can stick around for actually 1 to 3 hours in just room air floating. Most others just fall out of there and doesn't get infectious. So that's one part. The other part is, immunization rate has really reduced, and that's part of what's leading to that problem, because the MMR vaccine is approximately 97% effective, meaning if you do get that, and you get less viruses.
So I have heard time and time again that the virus itself can linger for quite some time, and I'm hoping you can tell us the amount of time that it actually would linger in the air.
1 to 3 hours, actually, which
Wow.
is really weird because, typically in a normal, like let's say influenza, you cough, it's a big particle, it flies up to 6 feet and drops to the ground. Here, it can float around, so once it gets into the air system, it can really circulate because it's so tiny. And again, it's so infectious, only a few viruses is necessary to infect somebody else.
How does it compare to other airborne illnesses? Is it subpar or something that is truly extreme and we should be concerned about?
It's extreme. That's a problem. The other part, there is a long incubation period. So after somebody gets infected, let's say at the airport, as you were talking about, they can go on their way and not know they're infected at all for the next 7 to 14 days. And they're infectious, which is also problematic, 4 days before the symptoms start and 4 days after they finish. So you may be infecting people without even knowing it, and that makes it much harder.
Yeah, and once that happens, obviously, folks are looking for symptoms, and I'm hoping you could tell us what are some of the symptoms that we should keep a close eye out for.
Absolutely. High fever, which is pretty obvious, cough, something called Koplik spot, which is a white spot, usually on the inside of the mouth, redness, and a white dot in the middle. That's a very classic measles. The other thing to keep in mind, if your eyes turn red, conjunctivitis. So high fever, Koplik spots, cough, but if somebody has red eyes and Koplik spots, it's nothing else most likely. It's probably measles.
And so, lastly, what are some of the delayed complications? Because obviously we now talked about some of the symptoms, but then there are complications, correct?
Correct. When, keep in mind, fatality rate, how many people die from measles, it's 1 out of 1,000, which is a large number of people, right? So pulmonary, a lot of times the lungs shut down, people die from that. And we're talking about like soon after the virus infection. And they can also be brain fever or encephalitis or infection of the brain, which is rare. Usually it happens in children or immunocompromised people. Let's say somebody suffering chemotherapy and they get it, they could have that and die from that. But they could be actually things called immune amnesia, which is an interesting term. It means all the various infections you've been exposed to as an adult, body forgets that, which is really problematic. And that could be something called encephalitis of the brain, delayed approximately up to 10 to 20 years, which is, it's not common, but it is possible. So the point is, ideally, you don't want to be infected. one of the best way to prevent it is MMR vaccine. Keep in mind, about 1 out of a million people die from MMR vaccine, as opposed to 1 to 1,000, 1 to 2,000 from the infection. So, I mean, those people need to make a decision based on information.
Yet again, we have been speaking with Dr. Eugene Lipov, kind enough to join us with the latest take on the measles complication we're now seeing spread throughout the DMV right here on the Live Zone. Sir, I truly appreciate your time.
Thank you for having me on.